For those who haven't met me, I'm Dr. Danielle Slade, AHPRA registered acupuncturist, principal acupuncture practitioner and director of Zenkai, a multi-award-winning clinic in the Macedon Ranges, to be specific, Woodend. Zenkai means complete recovery of health, and I've been doing that for just over 28 years, and I've welcomed over 778 babies into the world. I also mentor students, and today we are lucky to be joined by one of my finalists. I'd like to introduce Letty. Letty is a nurse practitioner working at the Northern Hospital Emergency Department, who is currently in her third and final year of her Masters of Chinese Med and Acupuncture at RMIT. As part of her studies, Letty would love to take a brief, non-identifiable case history with your consent. She will gently check your pulse and tongue and have a quick look at your tongue. She's very skilled and has a light touch. This will be a great opportunity for you to obtain a brief TCM diagnosis so your menopause treatment can be personalised. We would just like consent, so if Letty comes around to the table, she's going to look at your tongue and pulse and make a diagnosis, so that in the points that I am going to give you, some brief points, maybe the top 8 acupressure points to help, we'll be able to tailor that and do a little bit more depth. This will also help Letty with her final year masters, and you might even get a little bit more information than you expected. So whether you're in your 40s, 50s, or still Googling, is this perimenopause? Was my husband just a dick? He actually asked me to remove that line. No, you are in the right place. Sorry, Steve. Today we're talking about menopause. Not as a decline, not as something to endure, but as your second spring. A powerful reawakening. A time of transformation, deep wisdom, and quite possibly throwing out every underwire you've ever owned in favour of your soft bamboo everything. So in Chinese medicine, is this echoing? Is this okay?
Yeah.
In Chinese medicine, menopause is not a malfunction. It's not something to fix. It's not even something to dread, although, yes, your meltdown over Tupperware was valid. We call this time our second spring in Chinese medicine, because like Earth, after winter, you don't emerge, you bloom, wiser and wilder, and with far less patience for crap. You don't return to your 20s, thank goodness, but rather step into something freer. And yes, your symptoms are real. Your hot flushes, your mood swings, your anxiety, your exhaustion, your brain fog, and your mysteriously shrinking pains. But what if instead of suppressing these signals, we listen to them? Your body isn't broken, it's speaking, and Letty and I are here to help translate this using a TCM and an integrated medical framework. This transition, or the understanding of Chinese medicine, is about your kidneys and your jin, or your core essence. Do you want to do this bit? Yep. Okay. Because, our students know more, don't they?
Some days.
Many days, Letty knows a lot about the jin.
Thank you for inviting me to come and speak with you today. It's an honour to be working alongside Dr. Dan as well. When we're talking about gene, it's a bit of a hard description in English. We don't really have a medical term that we can say, oh, actually, gene will just replenish it. We'll just flick to our next slide. The best description, and Chinese medicine uses metaphors all the time, and the reason they do it is because they describe the indescribable. And this is difficult in West because when we can't describe something, often we don't investigate it. Chinese medicine will describe it with a metaphor. So in this case, a pot. If you imagine your gene is the wood and the fire that's underneath. This is in your body, this is what sustains you, it's what actually sparked you into life. On top of that is a pot, and it's got water and it boils. In that pot is what they call yin, or fluid, blood, nutrients. And over time, the gene will heat the pot up and it starts to steam. And eventually, if you keep taking the transactions out of the pot, you keep scooping the water out, you burn the night shift, you get really tired, you give everything you never put back in the pot. Eventually gets very, very low, and then it steams, and that's called steaming bones or yin deficiency. Now in time, we all go through immune deficiency. This pot and it's just a part of life. The water's going to be tipped out of it. It's okay, but what we can do, especially through Chinese medicine, is learn how we put the yin back into the pot to not let it get to that steaming bone, or what we know as menopause, and that's such a violent menopause as well. And I think that's where this medicine fits in beautifully.
So that's enough information about the Chinese medicine, enough for you to understand that that's how we see menopause and that's how it's different. Okay, so there is some good news. When I say Chinese medicine, does everybody understand that term? So acupuncture, but it can include other things like cupping and Chinese herbs, etc. But there is some really good news. We can actually top this energy up. So this is what's going on, and then we can come in and make some changes. So there are a couple or 3 or more common TCM patterns that that we see in menopause. This doesn't mean that there's only 3, but these are the common ones. Okay, so there's liver chi stagnation. So that's the angry presentation. That's the why am I yelling at the printer or at the dog or whatever. That's your liver chi stagnation presentation. Then there's another one called heart and kidney disharmony. And that's the person who's up at 3 a.m. racing and planning for things that they'll never end up doing. And the third type is the kidney chi deficiency. And this is the bloated, the fatigue, the emotional wobbliness, watching TV ads with little cute tissues and dogs. So there are 3 types, general 3 types, but I don't like to use the phrase, I treat menopause. I actually treat you. This unique pattern, your life and your glorious chaos, is what you will present with. And so in Chinese medicine, there may be some foundation, some framework around it, but I like to take a lot more of a holistic approach. In clinic, I use acupuncture. I would tailored nutrition and the healing power of rest. But those of you who know me well, that doesn't exist. I talk the whole time through clinic. I'm looking at all of you and I've got my head dipped. Sometimes the rest and prescription is simply giving yourself permission to nap without the guilt. A comprehensive consultation with an alternative practitioner, or just particularly myself, is a lot of pre-assessment questionnaires. There's a good hour of that prior to coming in. We review any relevant pathology or tests. That's with more of my integrative background, where we'll be looking at certain patterns there. Your TCM diagnosis, which is your time and pulse, which you'll be able to experience shortly. Personalised treatment. So you might come in for acupuncture, you might walk out with supplements, you might walk out with oh no, this one's wigging out, I better just do some kinesiology on it. So it's a bit of a combination. It's all about integrating this ancient wisdom with the modern care to help you feel your best. So we have your secret buttons. Are we on the next slide? Okay, so I'm going to get, with permission, Lydia's got to come around. Maybe she'll sit at one end of the table. If you can, she'll be close to one of you, and if others can just shuffle around a little bit, I'm going to proceed to talk to you about some of these acupressure points, followed on in the afternoon about some supplementations that may assist, and don't forget there's that big hamper coming up shortly. Okay, so we have some acupuncture points. There is just the 2 of us today, so we'll go through a couple of these and I'll tell you how to use them and when. This is acupressure, not acupuncture, okay? So I had a client, I refer to them as patients, and she told me, oh my gosh, I met a Zenkai, someone who loves Zenkai at the supermarket. I said, how did you know? She said she was bending down, pressing her kidney 7 down, and that's the point that we use for hot flushes. So if you all drop to your knees at Coles and do this certain point, I know you want mine, all right? So acupuncture points are like our body's secret, buttons, a hormonal cheat code. And because I love you, I brought some really cool acupuncture pictures to help with your description. These handful of points should be seen as your GPS back to your balance. Why can acupuncture treat or help you? First of all, let's talk about the difference between a hypodermic needle and an acupuncture needle. For those of you who haven't had acupuncture, which you're not having today, I'm teaching you acupressure, is that they're a very tiny needle or filament, and they're the size of 0.6 to 0.5. I have some for you to have a look at later, but they're not what we call a hollow needle. So if there's no hollowness of the needle, when it goes through the top layer or the epidermal layer, there is no pain or pressure, or if it is, it's very, very, very brief, because there's no substance going in. So for those of you who are working in the medical and nursing field, it's not the insertion of the needle, it's the pressure. When you've had your immunisation and your blood test, it's the pressure. So the acupuncture just glides between these nerve endings and not through them. So that's why a lot of people don't even know they're having the acupuncture. Okay? The body's, and when the needle goes in, that's when your endorphins kick in. So often some people will say, oh, I felt that one, but it goes within seconds. Skill does matter, and precision of points matter, and qualifications matter. So some of you will say, oh, so I had dry needling, and I have no issue, or maybe I do have an issue with dry needling. So dry needlers do a 24-hour course, where the acupuncturist does a 5-year degree. And so we learn about meridians, and we learn about not just where the location of an acupuncture point is. And the problem with that is some people feel like they're seeing an acupuncturist, but it's just a physio who's done a 2-hour course. And the problem with that is we talk about meridians, and meridians are like a pathway of energy. So I talk about it in my clinic as like the Calder Freeway. And the Calder Freeway, for those in the room who know, my daughter played Lily Potter in Harry Potter and the Cursed Child. Since she was 12, she's did that for 3 years. So there was a lot of pressure on me getting down that Calder Freeway, because she was Act 1, Scene 1. So there's a lot of pressure on that there's no blockages. Let's look at your meridians as blockages. I don't want any. I don't want to be behind the truck, the roadworks, or the car accident. What happens when you have dry needling is that they don't even touch on meridian therapy, they just touch on the sore point. And what happens is if we need our chi or our flow to go through to the Calder Freeway, and you get someone putting a needle into a meridian that they don't understand the energy, what happens is you're on the Calder Freeway, we're heading to Harry Potter, we're ready to go, but actually we didn't know that we're now on the Western Ring or we're on the Hume Highway. So that's the problem with dry needling. Yes, there's other risk factors, but it's more about you're coming in to work with energy and you're not getting energy work. So we're going to talk about kidney 3. I might just go back for 1 second. One thing you might feel when you've had your acupuncture is a tingle, a warmth, and a deep relaxation. We call this dirt chi, and it's a little sensation that comes in. But most of my patients will come in and look at me and point to the point they want, and then tell me that they're there for their acu-nap, because it is quite relaxing. I'm looking at Christy going, no, we talk the whole time, Dan and I don't get that service. Okay, Christy, I'm noted. We do chat a lot. So I can see Letty's working herself around her, so we'll get to that. I'm going to now explain how to find some of these acupuncture points. I think we've got enough, and then depending on time, I can come and place myself in the room and show you how to do these. I think I'll explain how to find them, talk about a few things like herbs, etc., and then I can come around the world and just sort of go, yeah, you're on the right track there. So finish my speech and finish off with a workshop to give myself that break. All right, so we have here kidney 3. I don't have those notes. 1 second. Come on, I'll move those. So kidney 3, and we're going to call this the kidney queen. So this point here is that, I'll show you how to find it in a minute, but this is a point that's amazing for libido. Come on, ladies, write it down. Kidney 3. So, this is kidney 3. It's also really good for charging your phone again. It's your charge button. Okay. So if this is your GPS point, this is kidney 3. I use it on most of my patients because it gives them the energy. So what I'm here today is saying, please go ahead. Make your decisions. The decision could be HRT. It could be HRT with natural medicine. It could just be natural medicine. It is up to you. I work with all women like that, and I feel that just because you're doing HRT doesn't mean you don't see someone like me. Because somebody like me can help you with an energy point or a sleep point or a libido point that you don't need to go and take more medications. I'm all for HRT. I have no issue with HRT. But there's a little bit more, and this is what I want to teach you. Now, this is kidney 7. Kidney 7 is just up from that kidney 3. I will explain. I'm not going to talk bones and anatomy. I'm going to briefly explain these for you. Let's just talk about the benefits of the points rather than the location, okay? So this helps regulate your hot flash and your kidney balance. This is the women down at Coles holding the points to get the relief from their hot flash, okay? So this is just above the bone, but we'll find location a little bit later. Then we have spleen 6. This is inside. All of those points at the moment are all on the inside of your leg. They're not on the outside, okay? So this is the inside of your leg. What's interesting about the inside in Chinese medicine, it's the yin aspect. So we have yin being female and yang being male. So it's on the yin aspect. So that makes a lot of sense, doesn't it? So then we have, this is your regulate sleep, this stress, this sweet cravings, your weight loss. This is the spread here. So hormones and weight loss. Then we have liver 3. Liver 3 is between these, the big toe and the second toe. And this is when you are wigging out. This is your diffuse button, okay? This one here, yeah, it feels like you've just had a wine and some other. Then we have heart 7. And this is your calm button. And this is when you're wigging out again and you don't know what you're doing, you don't know what you're doing in the fridge because you just forgot a few things. Do 20. The points they point to when they come to, that was a pun, that they come into clinic, and it's the top of your head, and it's what we're going to call our, what do I call this one? They're not really called that, that's my name, okay? The crown. Okay, queens, let's put our crowns on. This is the point at the top of the head that lifts your brain fog. Okay? This is the point that helps you remember why you walked in the room. But the theory behind it is it's the meeting point of all yang meridians in the body. So it is another diffuser. Ren 4. Libido. Let's just get to the point. This is a really good one for libido. And it's just below the navel. It's like, it's the nurturing, it's the womb, it's the bringing you, it's grounding you. All of these points help with libido. All of the ones I've mentioned. And then stomach 36. Stomach 36 boosts energy, helps with immunity, great for weight loss. Let's call this your chi starter motor. So chi means energy. So this is your starter motor. And these are your GPS back to balance points. So I would now like to, let's do the lucky hand pump. Let's do the fun bit for a minute because Lily's on table 1. So in your green bags, there's a beautiful Metagenics. Don't worry, they did help sponsor some of the hand pump, but there's a Metagenics book there, and at the back page of the Menopause guide, there's a business card. On the last page, but on the inside, there's one lucky winner that's just won a nearly $500 voucher about a hand pump. So in the menopause book, and it talks to you about, there's a diary in there. Show me your book. Yeah. I'm sorry. Do we have a lucky winner? So in the menopause book that talks to you about the other book, the Metagenics Pink book. Did you get it? Oh, no, oh. Inside that, there's a diary for you to write down your symptoms. And the other part of the information is how to advocate to your local GPs about your symptoms that Dr. Anne was talking about. So it's a great book, and there's going to be a winner. It says winner. On that, yes. Yay! I'm sorry, that's Doctor's writing. I had made the lucky golden ticket and menopause kicks in and I forgot. So you are the winner. And I would like to talk to you about, to the group first, about some benefits of some herbs, and then the herbs that you've won and how they benefit because they might not be suitable and we'll have to spray it. Okay? So the hand is this one over here, big one here. How you going, Lee? She's very good. All right, so I would like to, I'm sorry, I was getting I'm not saying don't do HRT. I'm saying that sometimes we can use a supplement to assist, okay? But then sometimes it's not appropriate. And so the question was over here before about interactions. So I'm very thorough in my interactive checks. So generally when you're coming in, I'm reviewing in this comprehensive way. I'm looking at your bloods, but I'm also talking to my technical team. And so I'm talking, so the nurses out there, the names of the world of, can this patient alongside this have this medication, okay? So sometimes when you're buying over the counter, it's not what I'm suggesting. So when Anne was talking before about regulated practitioners and things like that, when we come to medicine and supplementation, buying over the counter can be a big problem. And there's all interactions, but you think that, so I major in fertility. So people come in, they're saying, I'm taking Vitex. Well, you've got to come off that very slowly when you're pregnant because otherwise you can miscarry. So there's informed stuff that you're missing out when you're not taking regular things. So most naturopaths, etc., will do a complete review of you. Okay? So in regards to Estravir, I've just got to put the mic down for a moment. I will have a So sometimes our bodies need more than acupuncture and a good rest. I'm not dismissing the symptoms, ladies, at all. But sometimes we need a little bit more. And there are other versions that some can go alongside HRT and some of these can. But it's a little bit more of an individual and you might want to have a little chat with me, okay? So there is something called, it's plant-based, so for vegans. It's plant-based and it's rhubarb. So there's a lot of clinical research on rhubarb. So this tablet I'm about to show you helps restore balance, sleep quality and libido, vaginal health, muscle and joint discomfort, perimenopause, menopause. But it also helps with the vaginal microbiome, etc. There is other supplementations, that's just one example of them. Why is this so special? Like if I'm going to talk about anything, this is the one that's going to suit most of you. So I'm trying to give you takeaways. The takeaways are some acupressure plates, some tongue and pulse diagnosis, and some general herbal information, because I do need a little bit more sometimes. So the benefits of these, this sort of tablet is that, let's just talk about, it's your peacekeeping treaty in a tablet. So if you can use this alongside your HRT, and that's an if, we just need to discuss that on an individual, then it's going to help with all of those other symptoms and reduce things that the HRT hasn't got done, or everyone is going to present very differently. Your menopause might be the weight, yours might be the hot flushes, yours might be, you need to do a bit more detox, is a bit of a funny word, but yours might be, my allergies have worsened So when I say I don't treat menopause, I don't just do cookie cutter menopause in the natural therapy world. I'll try and see you as you're of perimenopause age. You are presenting with, and then what is it like, what are your top 3, and then we can go in. So on the back wall, take as many for yourself, for others, because they're not all hormonal over there. Take some pamphlets, see what else is available, because I'm going to treat what presents. You could come in for insomnia, you can come in for anything with a perimenopausal pattern, rather than I'm going to just do acupuncture for perimenopause. Does that make sense for everybody? Okay, so this is the tiny little tablet that we have here. So it's not one of the typical naturopathic first tablet. That's extra here. So if we can just spend a little bit more time, I would like to go through a couple of other things. So with Metagenics used to be practitioner only, which meant that I could hardly regulate what was going on. However, things have changed, and you can now buy online. You need to be connected to a practitioner, so that would be me. And we need to, sometimes if you're just buying something quite simple, you don't need to have a chat with me, but the rules have changed. It used to be practitioner only, that does not exist now, okay? I don't know why the company did that. The benefit for you guys is you can hop onto Metagenics, you connect to Zenkai. Zenkai is the name of my business, or Dr. Danielle Slade, same thing, and you can purchase, okay? I usually use that more on follow-ups after consultation, but you can go ahead and buy Estravira without speaking to me, which is up to you guys, of course. So then, if I can grab, I'm walking across the room. There is a few other things that can benefit from, you could benefit from, that HRT is not going to do for you. Like, you may need to restore your calcium. You may need to be on fish oils, etc. So I'm not here saying one or the other at all. I'm saying it's a combination of integrative medicine. So inside this box, we have a product here called FemX, and FemX is magnesium for hormone balance and stress. So it's a little bit all in one. I'm not trying to sell you herbs, I'm trying to give you key takeaways so that you understand that, oh, this might help for these reasons, okay? So I'm not here to do that to you. So the FemX product helps with PMS and muscle tension. It's got chromium in it and something else for PCOS type symptoms, so insulin resistance, etc., iodine, selenium, etc. But it's also got something in it that really supports your thyroid health. And so again, it's something that you can buy over the counter, but a quick look at some of your recent ones will be more beneficial for me. Vitamin D is in there for that wonderful lucky winner. So vitamin D for that bone density. So as Dr. Anne was speaking about the DEXA, etc., we should be on vitamin D. Again, you don't go and buy vitamin D over the counter from Chemist Warehouse. Vitamin D isn't just for bones, it's for immune function and muscle strength. It's also used for mood regulation, okay? And we need a certain amount of vitamin D to produce hormones. Why is this special? Women such as we're all from the masculine ranges, aren't we? Well, no. Welcome. Living in a cooler climate, we need vitamin D, ladies, okay? So Western medicine, Western medicine likes your vitamin D to sit at 50, so disease state at 49 and 50. Functional medicine likes you well over 100. So this is sometimes where there's a little bit of difference, and most women in the masculine ranges are not getting anywhere where they need to be. And if this helps with your hormones, then it's something to consider, as well as your bone health. There's a beautiful product in there. What's her name? Liz. Liz won. She won the dream box now. There's a probiotic in there for gut, brain, and vaginal health. So UTIs, metabiome, emotional well-being, and mood resilience. So it's something there that's not for everybody, but it might be. And then Anne was talking about inflammatory markers in menopause. So in the natural medicine world, we look at essential fatty acids. So fish oils, okay? Fish oils ain't fish oils, as they say. Fish oils need to be from a reputable company, manufactured and sourced correctly, because there's lots of heavy metals in the Chemist Warehouse products, okay? So I've mentioned to you, you should take fish oils and you should take probiotic. You don't go to Chemist Warehouse and buy fish oils from the Mouton Delta. That is not what I'm asking you to do. You can still buy this without me, okay? You can go and get this like you could go to Chemist Warehouse, but you need pure ingredients that are sourced, researched, and actually made on premise. So they do their own testing on premise. Metagenics, I stock other brands. I stock clinical, I stock a lot. And it comes down to what's the best for you and maybe a price point, because everyone will be on different spectrums there. So purified fish oils, free from heavy metals, helps with cognitive health and joint health. So that's something that you could consider, or you could eat more fish. We're not going to go down that topic of heavy metals in fish. Okay. Another one last thing that's in your box is protein powder, about that skin, joint and muscle repair. But who doesn't want to have reduced wrinkles and elasticity in our skin? So protein does help. It also helps absorb iron. But if you had hemochromatosis, we would have to talk about that. So as you age, your collagen declines, and so we need to help with that strong connective tissue, hair and nails. I will pause for a little bit. I haven't been able to speak sentences, and now that was pretty decent. That's 30 minutes. I'll come and help. We'll find some acupressure points for those who want to know where they are, and then I'll come and finish off with my last bit. Does anyone have any questions before I hit the floor? Need some questions. Letty's only here. Letty has to keep Randall. So Letty's only here from 11:30 to 12:30, and then she's going. So make sure you grab Letty over me, because I will stay for the whole day. Okay? Does anyone? I know I haven't showed you the points yet. But has anybody got any questions yet? Not yet? Nothing. Does that mean I explained well? Or okay? Or did I not address what you were coming in for?
Sorry about vitamin D. I just thought vitamin D was vitamin D.
Vitamin D isn't as scary as your probiotics and your essential fatty acids, because they've got a lot of additives. So for example, you could go down to Chemist Warehouse and buy some probiotics and think you're having 50 million organisms. Yeah, are they fit for human consumption? They are TGA approved, but they're not research clinical trials. That's a whole topic. You could really start on that one. Vitamin D, I prefer, in this one, in your hamper, I have a tablet, but my preference is a liquid vitamin D, and it's just about the purity. Okay, so I think Metagenics online is called Metagenics Liquid Vitamin D. And what's interesting is a lot of the bottles that you buy over the counter will say 1000 IU. Okay, your bottle says 1000 IU, but with a pathology test, it's an integrative medicine and it's a pathology for me. I'll look at your number and then I'll prescribe accordingly. So I can go up to 10,000 IU because it's liquid drops. I can dose you accordingly. Okay, so most of my women, they're coming in. And they're sitting around 50 and I want them 100, 120. This is fertility and so women's health in general, not just women. And so with the pathology then I can base how I dose you accordingly. So there's less risk with your vitamin D than the other two that I mentioned, but it's more about getting the best absorption and a few other things. But the best dose, you'll go and buy a vitamin D over the counter and you'll just take the stock standard. But if you do it with alongside some bloods, it helps a lot. And we have great practitioners, and we have the new clinic, don't we? The new women's clinic in Kyneton. Dr. Emma's closed her books. Have you closed your books, Anne? Okay, let's just be selective on what we say there. We've got great practitioners and we're very booked, but we have a brand new team in Kyneton opening up. That's going to take a bit of pressure off. Do they do a lot of menopause? They're doing more endo, aren't they? I'm looking at you.
No, it's menopause.
It's menopause as well, yeah. So that is somewhere where you know, we can start, and you just need to learn how to note take. So the book that I gave you is a diary of all your symptoms, and then there's some key questions that you should ask your GP. And so I'm trying to help you advocate for yourselves to get the care that you need, and whether it's HRT or no HRT, me, no me, it doesn't matter. It's more about advocating for yourselves and education. Education's power. Know the questions you need to ask. So I have included, I've got that book printed. I thought there might have been one missing, but I think we covered everybody today. Ladies on table 2. So would anybody like me to spend more time? I've got a cough, I'm sorry. Would anybody like to learn how to do the acupressure points for their symptoms? Yeah. Everybody? Okay, so how do I turn this off? Is it that? Where's my head? I'm going to press a button. Is that turn off? So I'll explain how to find them as best as possible. I could do a check on you, but you're not doing an exam. This is not a first aid course, and you're not getting certified. This is just acupressure. So your intention, can you hear me without a mic?
Yep.
Your intention is everything. So if you're a little bit off the point, I might correct you, but I'm actually okay with it. It will be good enough, okay? So we'll go back to the beginning. So even though I have lectured in my past, this is all just new. And if I don't do this right, I'm really sorry, this projector thing, okay? So let's do, not that, kidney 3. So kidney 3, we have to go to the inside of the leg. So everybody, leg position's perfect. So the inside of your leg. So kidney 3 on the inside of your leg. And see that bone? It's called the medial malleolus. It's just a bone. On the outside of that, between the bone and the outside to the Achilles tendon, there's a point there. The best way to find an acupuncture point is to actually close your eyes. And if you close your eyes and you feel for that point, you're going to feel a little slippery hole. Got it? Can I feel with my thumb or a finger? It doesn't matter. I would prefer your index finger, but yeah. So we're not looking for a pulse, that's why the thumb doesn't matter. But you'll find a slippery little hole.
Oh yeah. Oh.
Yeah. So you ladies are nice and in tune with your bodies, right?
And what do I do to it? Just
You press it, and you press it hard.
Okay.
So I'm talking about, I'm going to hurt you.
No, go for it.
So,
I might slap you.
welcome. So kidney 3, so this is that point, this is your charge point. So if we were to take very general comment about this lady, she is exhausted. That point hurt her. Sorry to bring you into this. And so those of you who have an empty iPhone and need it charged, this one. So the field legs. How long? Oh, hey lady, where are you, darling? How long would 2 minutes? Press. Yeah, 2 minutes. Whatever you can do it whenever you do. So if you're a patient of mine, you have and you're going to hold it until your hot flush stops. You're going to hold this for a minute and then come back 10 minutes later and do it again. Bilateral means both sides. So when you're doing these points, you do it on both sides. Okay? But there is a trick. I'll get the mic. Otherwise I'm not
Mine was a fake
Can you hear me? Okay, so bilateral means both sides. So that's ideal. But those who are time poor can't do it. The right side is your yin side. So what that means is that's your female side. So if you're time poor and you've got 8 points that I've suggested, you won't need all of them, then always go to your right side. Is that clear?
This hand has changed though. This hand has changed.
Okay, you know who does
Okay,
this?
so it's always
Yeah.
right side.
Oh yeah.
Right side.
Yep.
So
all I could think
inside,
about when
yeah.
she got, I went,
Female.
So I'm on my back side.
But that's okay.
That's the spot? Like that's
Yeah, well, yeah. We won't be going there.
Yeah.
We won't be going there.
Yeah.
I can tell.
Yeah.
I can pick that up. So while we're on the kidney point, the one above it, the kidney 7, is the hot flush point. Now I'm assuming a lot of people want to know about that one. So kidney 7, so where you found the kidney 3 point, you're going to just go up a couple of fingers up. Okay? Can you see that?
Is that a hollow as well?
All acupuncture points, if you use your gut, feel slippery. But it takes years to do it, so don't worry if you don't feel it. So kidney 3, kidney 7, that's your hot flush point. So approximately, lady, did you do the sun measurements, honey?
Oh, there.
So two suns that. I'll just tell them 2 thumbs. Okay, let's make this easier. So that measurement up there, that some people have requested me to send to you guys, is approximately your thumb, not my thumb, 2 thumbs up from that kidney 3 point. Okay? So 2 sun, it's actually measured here. Let's not get complicated. Let's do the width of 2 of your thumbs. Does anybody want me to spot them? Okay. So this is for hot flush, and this is kidney 7, and it's that word there that says 2 sun. Don't worry about that. First year of university, I used the word come. I did. I said, have you found the 2 come? Yeah, I did great today, it's fine. So that word means sun, and that is a measurement system, and it's approximately 2 thumbs worth or width of your point. So you found your kidney 3, and then go up 1, 2 thumbs. Okay, that's a confused face. So you know how we found kidney 3 here? Right, then you're going to go up very fast, 4 thumbs. So kidney 3, thumb, that's your hot flush. Anybody want any assistance? That's the next slide, is spleen 6. This one here. So spleen 6 is 3 sun, not 2 sun. So we're all on the we're all on the inside of the leg. So you just found kidney 7, which was 2 sun. So with the 3 sun, just use 3 fingers approximately. Where the original point of kidney 3. So I'm going to now just finish up a little bit. What time? Ladies are leaving shortly, so just be aware of, if you haven't called Lady, try and grab her, and or you can still chat with us, but the tongue and pulse diagnosis part is here now. So let's talk about what they call Yang Shen. Okay, so this is when we get juicy. So Yang Shen means nourishing life. And no, it's not about green juices and ice baths, unless you're obviously into that. It's about your second spring. And your second spring might look like warm, cooked, and hot, soul-hugging food. It's getting into bed before you start doing scrolling. It's dancing to the 90s and R&B. It's saying no like a queen. And no is a complete sentence, and you need to understand that. This is not about doing more this time, or the Shangyan in Chinese medicine. It's about choosing better. Dietary tips for menopause. Chinese medicine is quite individual, so this is a very generalised, but warm foods. And what I mean by that is not taking food from the fridge, not drinking your water. See how we had our water on the bench? That makes an acupuncturist really happy, okay? So warm foods that are easily digested, because we don't want to weaken our system any further. That means avoiding raw and cold food. So some of you are going to talk to me about juicing, and generally depending on your constitutional type, so everyone's an individual, mostly raw cold foods are not for you during this stage. I need you to focus on kidney foods. And now these include, you might need a pen, black beans, sesame, walnuts, soups, congees if you're into that, and teas. So everything that you're going to put in your mouth is already readily digestible, and therefore your body doesn't have to work so hard. Okay? You are not fading, queens. You are growing. So what if we stop resisting the change? What if we stop trying to be the women we were and start loving the wild, wise women that we've become or becoming? This isn't the end, it's a rewriting, a sacred, sweaty and spectacular permission slip to reclaim your voice, reconnect your body and reimagine what's next. So I'll be around for a little bit longer and Lady not so much, but if you need to work through any more points and try and get as much a diagnostic done if you choose to, then I'll try. I'm staying for the whole day. Okay, it's just Lady that has to keep wrangle. Yeah.
Can you just run through those kidney foods again?
Sure can. So kidney foods, I should know these off by heart, but I will say the same things, okay? So warm foods. So it means water on the table, apples not in the fridge. My preference would be that you would have a stewed apple if you're going to eat an apple. It talks about not eating raw and cold foods, so please be careful of your morning juices. If you're going to have a juice, the little secret is to add a slice of ginger. Ginger is quite warming, but menopausal ladies, I'm not sure. Just avoid the juicing if you can. So the other kidney supporting foods, remember how Letty explained the kidney and that was the wood fire and that gets depleted, and when that's depleted you get your menopausal symptoms. So foods that help the kidney are black beans, sesame seeds, walnuts, soups and teas. Yeah. Is there any more questions? You're looking at me to hop off the mic?
You feel you're done?